And good morning, Danielle.
Good morning. How you doing?
I'm good. Can you hear us and everything?
Yeah, I can hear you. Can you hear me okay? I'm not shouting at anyone?
No, you're perfect. Amazing. So exciting to have you on this call today. Go ahead.
Thank you for having me. I really appreciate the opportunity with you guys.
No worries. I loved our coffee morning when we did it in person. And I just thought, this is so much better to be able to share it with more people. And we have had lots of interest in the group of people saying, oh, but, I'm at work, or, oh, but, I'm abroad, I'm in a different time zone. I won't be able to watch it and join it, but I'll watch it at a later stage. So we'll share the video with everyone and we'll share it with you as well. So you can forward it to clients if you wanted to.
Great. Thank you.
So hello, everyone. And Danielle, we always start these calls by you introducing yourself, because you'll do a much better job at it than I do.
Sure.
Danielle is a super experienced physiotherapist that we send lots of clients to, and we get fabulous feedback. And that's why we've invited her to the call.
Thank you. Thanks, Johanna, and thanks, Deanna, for having me on board, and welcome everyone that's joining us today. As we all know, my name's Danielle Barratt, and I'm the founder of PhysioMatters. We're in the Orchard Road area, and basically we treat male and female health and physio issues. We also treat kids as well and things as well, and musculoskeletal. Which, sorry, just got a little bit of background noise there. But I've got 28 years experience in physiotherapy, and our website sort of tells 1,000 stories. So I'm hoping today you get a lot out of today's session. And if you have any questions, please ask them as soon as you'd like at any point in time, and we'll come back and answer them. I think at the end, it's better to answer all the questions at the end.
Okay, it depends. If it fits the topic, we can also do it on the spot. So, mummies, what I'd like you to do is put your questions in the chat, or raise your hand if you think you can speak to Danielle directly. That's possible as well.
Yeah, okay. And there's no silly question. I mean, please ask them. If it's easier to ask them as we go along, I was just conscious of time, please do so, and I'll answer them as we go. And if you feel like you don't want to ask a question or it pops up later on, just send us a message either to Johanna at Bumpwise or to me, and I'll answer that for you.
Amazing. Thank you so much. Yeah, we can get started. You have a very long, amazing presentation prepared, so I'm really excited to see it. So if you want to start screen sharing now.
Okay, will do.
Amazing.
We're just sharing it. Sorry, won't be a second. I'm not sure why it hasn't. Sorry.
Okay, just ironing out some difficulties, no problem. Mummies, if you have questions for Danielle, you have the chat opportunity as well. So please make use of that. We can't see the full slide for some reason.
Yeah. Just have to do the traditional way. So sorry about it.
Okay.
Oh, okay. Yeah, I put the...
You think you prepare these, you practice, and then it doesn't work.
Yeah, exactly.
But that's okay. So today we're going to talk all about backs, breasts, bellies, which is really very much Danielle's speciality. There we go.
Okay. Yep. There we go. Let's get going. Sorry for that delay, guys. Technical hitch. Okay, a little bit about myself more formally. As you can see, a women's health physio. I wanted to put this in because a lot of people say, what do women's health physios do? And this is what we do. We're qualified, we're registered, we treat backs, breasts, bellies, and below. And when I mean by below, I mean by pelvic girdle pain, pelvic floor muscular pain, and things like that. And we treat women of all ages and or men of all ages. But we'll just focus on the needs of women today in this talk. So we're going to talk about the changes in the body due to pregnancy, postural changes, diastasis rectus abdominis separation, or DRAM, pelvic floor muscles, where they are and how to exercise them, and backs, breasts, bellies, and below, and more other pains that sort of pop up as we go along. as I said, ask any questions if you like. So why do we get these changes in our body? I wanted to highlight the fact that our bodies are always changing as women, and a lot of it's due to hormonal changes. That might be relaxin that's flowing in our body due to pregnancy or breastfeeding. There might be estrogen changes as we age, or progesterone changes in pregnancy. It might be due to the woman's age and nature of conception. If you've done IVF or IUI or had some support with your hormones, that may cause some body changes to you as well. You may have had other pregnancies, multiple pregnancies, multiparous women, or you might actually have twin pregnancy or a triplet pregnancy. The position of the baby in utero also makes a difference to the body and how your body responds. The weight of the baby and also your pre or postnatal fitness will have an effect on your body and how you feel. So the first topic I really wanted to focus on, ladies, was about posture. And the reason being that a lot of ladies that I see for DRAM issues or pelvic floor issues, a lot of it stems from posture, the changes in their posture. They may have had poor posture prior to pregnancy, and that's not being corrected, and therefore their DRAM or their muscles are not working effectively. So in a good postural situation, or in normal posture, I should say rather, we've got three natural curves, one in our back, a cervical, one in the thoracic and one in the lumbar. And these curves are there to maintain our posture, maintain us in an upright position for balance and stability and for structural support for our muscles, tissues, and ligaments. Now, what happens in pregnancy is these postural curves will change, particularly in the lower back there. So I'll try and stand up so you can see, but in that lower back, that lumbar curve often increases and exaggerates because you're counterbalancing the weight of the baby and the tummy in front. So therefore your center of gravity changes. Quite often ladies feel a lot more weight either in their heels because their bodies are leaning forward. Some ladies' feet will feel quite achy despite being a little bit swollen in pregnancy at times. They feel achy due to poor posture. And the arches of the feet change as well in our pregnancy. All of this will affect up or down the spine. So some ladies will get a more of a neck protruding forward, a little sort of poking neck forward, or they may counterbalance just with the tummy forward. So if we come into physio and we can correct your posture, you'll find that your diastasis or your DRAM will change as well. Now, I've put these pictures up here. Terminology-wise, diastasis means separation, and rectus is referring to the front abdominal wall. Some people talk about DRAM, some people talk about DR, or just a separation. But you can see there's 5 or more varieties of separation here that occur. Now, why do we get a separation? Because our bellies are being distended due to our pregnancy, due to hormonal changes, due to posture and everything that I mentioned. So what you've got there is you've got a rectus muscle coming this way, and that muscle bends you and forwards and backwards, and you've got oblique muscles at the side that come round, and you've got a deeper transversus muscle connecting you underneath. You've got skin, fat, and tissue over that connected in a little, a thickened joint down the middle called the linea alba, and that all stretches. So if you have a look at these models here, or these pictures here, you might have a variation in your separation and different to someone else. The most that occurs, or the larger times that we see, are up here on this model here. I hope you can see my arrow pointing to the second from the left, I would say.
You can't.
You can't. Okay, the second from the left there, sorry. Okay. Now, mums often come in. Now, your tummies may look very similar to these mummies' tummies. These are real people. They're real clients. They've not been made up. And I just wanted to put them up there to say, look, if your tummy does look like this, there's quite likely that you do have a DRAM, a muscle separation. And if you look at on your screen, on your left of your screen, if you're facing your screen, that's a umbilical herniation there too at the belly button. So that commonly occurs with mums as well. We know that the skin gets stretched, and you can see in that middle picture it's quite clear, and sometimes you get stretch marks too. They commonly occur in the pregnancy, and they all may be associated to what's happening beneath the skin as well, causing that diastasis rectus abdominal separation. Okay, so the causes of DRAM, I've mentioned a few in the beginning, but I just wanted to rehash them. One, naturally pregnancy. We're talking about pregnancy being a cause today. It might be the baby's weight. 4-kilo babies or more are considered pretty heavy babies to have in that area when you add the amniotic fluid and the placenta to that as well. The baby's position. Sometimes babies lie transversely across the belly. Sometimes they sit one side or the other, and that can stretch out your muscles more on one side or the other. You may have had several babies before, or, you know, 1, 2, 3, 4 children before, or you may have multiple twin pregnancies as well. You can have hormonal effects, which affect your DRAM. Pregnancy, progesterone, relaxin we've mentioned, and maybe the changes in estrogen in breastfeeding as well can affect your DRAM. Returning to exercise is a big one. We want you to get fitter, we want you to get stronger as soon as you feel comfortable. But generally, returning to exercise, you know, a controlled exercise from 6 weeks onwards is the way to go once you've had your diastasis and your pelvic floor checked. That doesn't mean to say that you can't exercise, ladies, before that 6 weeks. Common practice is we used to get clients in around that 6 weeks because we say that it will take about 6 weeks for the uterus to go down in size. I'm commonly getting patients in now at about 3 weeks, checking their pelvic floor, checking their diastasis, and seeing that the uterus is going down on real-time ultrasound, and getting them started a little bit earlier, working on very basic exercise with a full internal assessment, perhaps at 6 weeks onwards after that. So coming in sooner to check is often better, particularly if you're really keen to get back into your exercise and you've established a routine at home. Doing the incorrect exercise, ladies, we want you to return to boot camp, and we want you to return to rotational and boxing activities, but we've got to get those muscles stronger in the belly first and a good pelvic floor before we do that. Okay. So how to assess your DRAM. You've got me laying down there, and there are several articles out there on how to do that, but basically laying flat, no pillow underneath your head, knees bent to 90 degrees, and the reason being that that takes the stretch off the abdominal wall. And then place your hands horizontally, not vertically, horizontally, about an inch above the belly button. Lift your head, come up, and feel that gap between your muscles, the right and left rectus abdominis. Then you can repeat that again at the belly button and repeat it about an inch below the belly button. And I'm happy to send out any pictures for anyone if they want further explanation on how to assess your DRAM. But I often do that in the clinic manually with my fingers or with calipers, or more importantly, the gold star is to use real-time ultrasound. So I've got a real-time ultrasound, and if you come in, we can look at your tummy muscles on how they work, and actually accurately measure your DRAM. Please do come in with a semi-full bladder, as the ultrasound uses sound waves to bounce off water, and we get a better image in a picture if we've got some fluid in the bladder distending the abdominal wall. Okay, so how do we treat DRAM, ladies? First of all, you've got to choose the correct exercise whilst you're pregnant and the correct exercise after pregnancy. And that's where we come in as physios to help you do that. Please, in pregnancy, it's not a time to start a high-level impact sport like jogging if you haven't been jogging beforehand. And jogging can be, or running can be safe in pregnancy, depending on the pregnancy and your fitness level and your activity or level of jogging beforehand. But if in doubt, please check with your obs and gynae, and or check with us as women's health physios, and we'll be able to tell you sort of what level of fitness that we think you can do in your pregnancy. Breathing is the main key. I mean, it's breathing is our life force, but breathing in pregnancy and with exercise is crucial. I always say to clients, you should be able to exercise, maintain a conversation with the person next to you, and breathe regularly and rhythmically. And if you can't, then you've got to check in with your body and say, hang on, am I exercising too hard? Am I working out too fast? You might be. So we have to have a look at that. I'd like to focus today at the end of our talk on pelvic floor exercises. 1 in 3 ladies will have issues with their pelvic floor at some stage in our lifetime, and I'll talk about a few of those issues, but it's so important as the pelvic floor forms the base of your core and floor muscles and helps to support and close down this diastasis rectus abdominal separation, this DRAM. If you have any questions, ladies, please ask them at any point in time. I'd love to answer them for you. So I put in this slide just to show you the real-time ultrasound. It's not done vaginally, it's done via the belly area. So we're looking at the separation and can look at the pelvic floor, and you get some very clear, accurate measurements. And it's fun, and it's a great learning tool for those that really learn via visual learning. This is a great learning tool that's non-invasive. It's part of the consult. It doesn't cost you any more money. You just like you to come in quite hydrated and or with some fluid in your bladder. Okay, so those of you that know me well out there, you know that I work out with my horse every day and love him to bits. This fortunately is not my horse. This guy is looking a little bit old and definitely needs to work on his core muscles, but we do get animals working on their core as well. So I just wanted to show you it's not just for humans too. Okay, so with core strengthening, we've got to focus on those primary muscles that I mentioned, the rectus abdominis, the transverse abdominis, and I'll refer to that as the TA, and the obliques, the internal and external. The research now is really focusing on working on that primary muscle, being the rectus abdominis in front, and the other muscles secondary to that. We're really trying to close that gap with our six-pack muscle more and more now. And the other muscles that support our core are our diaphragm, our breathing muscle, the pelvic floor, and the glute muscles, the muscles in our bottom. All right. So if you think of your core and how to approach closing down your diastasis, it's all about the abdominal canister. You've got the diaphragm up the top where we breathe from. So you've got your diaphragm up here where we breathe rhythmically up and down. You've got the pelvic floor at the base of your canister, and you've got the abdominals in the front and multifidus at the back. And I'm not sure why on my slide, my last letter of everything has jumped off. I apologize for that. I'll have to fix that later on.
Took a picture to show you.
Yeah, it's a good picture, but I'm not sure what happened there. So I just want to touch on breathing. Breathing alone is a massive, big topic for everyone. And why I put this in here is what people don't often realize is when we breathe, our diaphragm is the muscle of which we breathe from, and that has an effect on our lungs. And you'll see when we breathe in, the diaphragm actually goes down. So it puts a lot more pressure downwards on the pelvic floor and on our abdominal wall. When we breathe out, we exhale, the diaphragm goes up and takes the pressure off the abdominal wall and off the pelvic floor. So a rhythmic breathing is what we want, and often initiating an exhalation when activating a muscle or loading up a muscle gets a better muscular response at times. So I guess to take away from this, ladies, is always breathe. And if in doubt, or if you have to lift a load, even lifting your babies, they are a load and they're getting heavier, exhale, pick up the baby, and then breathing rhythmically from that. So just be mindful that your breathing is controlling the pressure down in your pelvis and on your tummy wall. Okay, pelvic floor muscles. So was that the right one? Yes, it is. Okay, going on to the pelvic floor. Of my pelvic floor. Here we are here. I hope you can see this, ladies, and if not, it's very, very clear in the picture. So the pelvic floor, as I mentioned earlier, the importance, I'll try and get a good picture for you, is the base of the pelvic, those pelvic floor muscles. It doesn't appear to be quite as clear with our reception there. I'm not sure why with the camera, but there we go there. So the pelvic floor, if you're looking at the model there, are those red muscles. You are seeing a bit of, it's a bit confusing, that model on the slide there, that you've got the uterus. So I'll go systematically because my pelvis is not showing up in the picture. But in the front, near the pubic bones, you have the bladder. Behind it, you have the uterus. And behind that, you have the rectum, the back passage. Those muscles that you're seeing directly under the bones there are the pelvic floor muscles. And they come from the pubic bone at the front to the back of the tailbone at the back here. And those muscles act like a sling, and they hold those contents, those organs that I mentioned, up and in. Okay. Now, I'm going to talk you through a pelvic floor exercise in a moment, but before you do, if you're on the line and you're on this session, if you've had any bleeding or you've had any early contractions or you've got any reason that you think maybe perhaps even a low-lying placenta, that you're at risk of sort of feeling uncomfortable doing your pelvic floor, please don't do them and come in and let us check your pelvic floor and see where you're going. But if you don't have any reason that you wouldn't be able to do a pelvic floor, the pelvic floor contractions are safe for most people, only if you've got perhaps issues or had complications in your pregnancy. So let's talk, yeah.
Quick question, postpartum, how early on can moms do this? Whether they've had a vaginal birth or a C-section, is there any reason not to do it straight away?
Yep, great question. Thank you for asking that, Johanna. You can do the pelvic floor exercises straight away unless your doctor tells you otherwise. Now, the only reason why I would say ask your doctor about are they comfortable in you doing your pelvic floor is with a vaginal delivery. If you've had a tear or a episiotomy, technically you can activate your pelvic floor straight away. However, if it's uncomfortable to do so, or there's extreme swelling around that area, or the doctor's stitched in a certain way and would rather that you waited for two days probably 3 days, and that's fairly understandable. But otherwise, considering all being well in a vaginal birth, you can start straight away. And with a cesarean delivery, you can start straight away with your pelvic floor exercises. I guess the limiting factor would be the nature of the surgery by the doctor, if there's a reason why that they would rather you didn't, and or if you have any pain or discomfort. So I would recommend starting as soon as you feel comfortable within the first 24 hours after delivery.
Amazing. I actually give my clients pelvic floor exercises from the start because I think it's really important, and that's what we teach in the West actually as well. In Austria, Germany, everybody gets them from the day the baby is born.
Yes, we're the same in UK, Australia, and the States where I work. We would start them straight away, even coming back from theatre if you're comfortable, because it's just going to help support you, support your core and support your floor. However, I do know here we're a little bit more cautious, and some doctors would rather you wait 24 or 48 hours if they've done some extensive stitching or if there's swelling. So I always think it's good to just run that by your doctor if they're comfortable with it. And it's even better if you've learned how to do pelvic floor beforehand. So I often get mummies to come in the last weeks of their pregnancy if they haven't been in already, learn how to do the pelvic floor via the real-time ultrasound, and then you know how to do them really, really well after delivery.
Amazing.
Okay, so let's talk through a pelvic floor exercise. Really simple, ladies. You don't have to change your position in any way. You could do a pelvic floor contraction whilst in a headstand or at yoga if you like. The main thing, as I always say, is please breathe rhythmically, naturally, and comfortably. All right, now let's start by closing off the back passage. Let's pretend you want to close the back passage and stop any wind or gas coming out of that back passage, that back end there. See if you can close that back passage and release it. Have you ever thought about that back passage before? Give it a go and just see if you can feel that. Quite often clients say, oh, I've never thought about actually consciously closing that back passage. And if you do you get any glute contractions, any bottom muscles contracting at the same time? And if they're contracting at the same time, just relax your bottom muscles and just focus on the back passage, the feeling of stopping wind, gas, or a poo. Close that and release it. Just try a couple of those whilst you're sitting, standing, or with a baby. Just have a go at the moment. I then want to draw your attention to the front passage. I always say to ladies, picture if you were sitting on the toilet having a wee, and midstream of that wee, what are those muscles around that vaginal area, that urethra, that you can close off and stop that wee flow? Have you ever done that? Have you ever sat on the toilet, gone for a wee, and midstream stop that wee flow? The muscles that are doing that are your pelvic floor muscles. Try that every now and again. We don't recommend you doing it daily or even sort of probably more than once or twice a week, really, to contract your pelvic floor whilst doing a midstream wee test, because we don't want to confuse your bladder and your bladder frequency. But every now and then you feel comfortable, check in with your body, close the back passage, close the front passage as if you're stopping a wee. And then if you can master the lift up of those muscles and relax, that's what we're wanting. We're wanting a closure of the back passage, a closure of the front passage, and a lift up of those muscles. I hope that's sort of coming across clearly in the picture, but a lifting up of those muscles, because we want those muscles to withstand any pressure that might come from a cough, a sneeze, or the diaphragm above, or the change in your breathing above. So before we finish on the pelvic floor and how to do them, I want to talk you through, let's say, 5 quick ones and 1 slow hold. So to do the quick exercises, these muscles are the same. The timing is just different. That's all. We're talking about closing the back and front passage, lifting up for 2 seconds, resting for 2 seconds, lifting up for 2 seconds, resting. Close that back and front, lift up for 2 seconds, rest for 2 seconds. Close that back and front, lift up for 2 seconds and rest, okay? Now for a long hold, we do exactly the same thing. Close the back passage in front, lift up and see if you can hold for 10 seconds. Lovely natural breathing, lifting those muscles up. Think of a hammock or think of drawing those muscles up internally and relaxing for 10 seconds and letting them go. So quick action is usually a lift up for 2 to 3 seconds and a drop down for 2 to 3 seconds. And a slow one is a 10-second lift and a 10-second drop. Okay, so how would you know if you had any issues with your pelvic floor? 1, come in and see us and let's have a look. We can do real-time ultrasound and if we need to, an internal exam to complete the full awareness of the pelvic floor. But if you have any form of leakage from the bowel or bladder, you shouldn't have at all. And I get so upset when I see mummies coming in and saying, oh, I thought that was normal after I've had a baby, or it's normal in pregnancy. Ladies, it shouldn't happen. Please don't accept it, because if it's starting now, it's probably going to continue on later on in life or come back later in life. So please get working on your pelvic floor now. Think about the bladder frequency and how often you go to the toilet. Normal natural weeing for for women is 5 to 7 times a day. That's roughly every 3 to 4 hours, and once or twice at night, or even at night if you're breastfeeding or if you're pregnant. In terms of the bowels, once a day to up to 3 times a day is normal and natural for some people, as long as you've emptied your bowels within 3 days. So think about how often you're going to the toilet out there, ladies, whether you're pregnant or otherwise, and do you fall within that normal range? If you're getting a heavy or a dragging sensation in the perineum or vaginal area, that might be what we call pelvic organ prolapse. So please come in. It's usually related to your pelvic floor. And you might have other symptoms related to your pelvic floor, such as vaginismus, painful intercourse, and perhaps intercourse has always been painful even prior to falling pregnant. We can address that even after you have your baby. Bladder infections, if you're getting recurrent bladder infections, it might be a tightened pelvic floor. If you get a vaginal stabbing pain, I know when my pelvic floor was tightened, I was walking along once and went, oh my gosh, that pain is so intense. What is that? It was simply a tightened pelvic floor. So I went and saw a women's health physio to help me release my pelvic floor because I couldn't do it myself. If you're getting any coccyx pain, any tailbone pain, I often see mummies with tailbone pain. The pelvic floors have gone into spasm, particularly in a delivery, whether it be cesarean or whether it be vaginal delivery. You can still develop tailbone pain in the pregnancy and delivery. Okay, bladder changes, as I mentioned incontinence earlier on, but honestly, if you cough, laugh, sneeze, or jump, you should not be leaking urine. And I want you all to feel confident getting out there on a trampoline with your kids later on and bouncing away and not having any leakage. If you find that every time that you feel an urge to go to the toilet, oh gosh, you've got to go quickly, that might be urge incontinence, particularly if you leak just before getting to the toilet, or a sense of urgency as well. Frequency, I've mentioned to you, the normal natural frequency for your bladder, 5 to 7 times a day. Once or twice at night is acceptable, but anything extremely outside of that range, please, ladies, come in and check your pelvic floor. As I've mentioned, I wanted to highlight pelvic floor tightening because a lot of us out there think our pelvic floor is only being weak or not strong. It can often be a tightened pelvic floor. We can have a strong pelvic floor and a tightened pelvic floor. We can have a weakened pelvic floor and still a tight muscle pelvic floor. So if you're getting any symptoms where your pelvic floor might be tightened, and they might be, symptoms such as the increased frequency, a pain in that vaginal area, sex might be painful, or you may have been diagnosed with vaginismus, or you may have a precondition behind all of this, like polycystic ovary, which might be causing some of these symptoms. We need to look at how we downtrain the pelvic floor, how we relax the pelvic floor. And you can use different techniques like breathing, visualization. I'm happy to teach you and show you that. And it is very, very effective with research backing up all these techniques. Perineal massaging. I like to do a lot of perineal massaging for ladies in that 35-week onwards if you're planning to have a vaginal delivery, because we have research to support that perineal massaging. And you can see me in the picture there. We can start with as small as 1 finger or even a earbud size, stretching those muscles around that area, and then progress to 2 or more fingers, stretching those muscles out of the perineal area and the pelvic floor so that vaginal delivery can be easy and we reduce the risk of tears or episiotomy. But if sex has been painful, perhaps it's been due to a tight pelvic floor, and some perineal and pelvic floor releasing will help. We can also use vaginal dilators, and I prefer for you to come in and me teach you how to use those. Then you buy some off the shelf or off the net and get the wrong ones. And also just providing with some emotional and psychological support as how you navigate your way through a tightened pelvic floor or a loosened pelvic floor can really, really help you gain control of your pelvic floor and your daily function in life again. I just want to mention bowel changes, ladies. Pelvic floor can affect your bowel in terms of constipation, not being able to use your bowels, lots of wind or gas, and sometimes it's just changing diet. When you're breastfeeding can affect your bowels as well with wind or gas, or you might have loose stools as well. So often I work in hand with a dietitian or a lactation consultant, as well as myself, and we work as a team to try and help you get some regularity with your bowels. Now, I've put this picture in, guys, because it's easier to show you. When you come in, you'll see a picture as clear as this. That black space in the middle there is your bladder. The green space below it, that PFD is a midline of the pelvic floor muscles. And so basically you've got the pelvic floor muscles left and right, and you've got the rectus abdominis, that RA above muscle. When you contract your pelvic floor, those muscles left and right and centrally in that midline lift up your pelvic floor and support you. And that's what they should do reflexively if you cough, laugh, sneeze, or jump, or with exercise. But quite often they don't. And ladies will come in and will be so surprised that they're actually bearing down and pushing down on those pelvic floor muscles. Okay, so come in and have a look on real-time ultrasound. I hope I haven't lost you all at this point because I'm giving you lots of information here. Please ask any questions at any point in time. And if you feel like I'm going too fast, do let me know. Okay.
We'll break here, Danielle, and see if there are any questions in the audience.
Sure.
Mummies, would you like to ask anything? I was also, wondering if when you talked about breathing, do you teach breath in pregnancy to achieve, a little bit more that rib cage expanding? Because obviously the breath can't go downwards as much with the baby occupying that space. And also breathing for pushing.
Yes, absolutely. Yes, I can do. I used to in Australia always teach breathing for pushing, but I know you guys do that really, really well as the doulas. So I don't sort of encroach upon that area, but I absolutely can do. But I do teach breathing in pregnancy because a lot of our spinal issues or pain in our back often come to due to poor breathing. The baby might be pushing up on that lung area. The organs have moved around and there's reduced rib expansion. So I do teach that. And simply by placing your hands around that base of the spine, base the rib cage there, and just expanding is one way of doing that, expanding those ribs outwards as much as you can in your natural breath, and then relaxing that rib cage downwards. And it usually takes 3 or 4 of those rib expansion breaths, or we might call them diaphragmatic breathing, to loosen off your mid to lower back there and make you feel a lot more comfortable. So I can teach you how to do that a little bit more in detail than what I've just shown you there, but it does really, really help in those aches and pains in pregnancy and just regaining your core back after pregnancy as well.
Amazing.
Yeah, okay. So what I want to do is now have a look if we haven't got any questions. Have any questions popped up there?
Right now, we haven't. So let's continue and then maybe have a Q&A at the end. Okay.
So breathing normal, naturally, rhythmically, and comfortably. You know how to engage your pelvic floor by closing that back passage in front and lifting those muscles internally upwards. And I just want to draw your attention now to that third component, maybe being that lower abdominal muscle called the transverse abdominis. Now, a lot of mummies come in and they're really unhappy about the mummy poocher, the belly area below their belly button sort of sticking out a little bit more. Some of that might be loose skin. Some of that might be a little bit of fat. Some of it's aging and hormones that we can't change. But a lot of it's to do with this muscle called transverse abdominis. And that muscle sitting, basically, if you put your hand on your belly button to your pubic bone in that area there. And what I often say to clients is, listen, pretend there's a piece of string attached to your hand and someone is behind you and they're pulling that piece of string. So if I relax my belly and I relax my transverses, here we are here. You can see there's a big belly here. I'm an old lady with a big belly now. So if I relax that belly, now I'm going to contract that belly. Here's my hand. I place it between my belly and my pubic bone here. Pull on that piece of string and I'm drawing those muscles inwards. You can see that my belly goes downwards and hopefully is a lot flatter. Now, it's not just a cosmetic reason that we do that. That transverse muscle is one of the most main stabilizing muscles of the lower back. So your transverses can work well in conjunction with good breathing, pelvic floor, and bringing on that transversus. So that's why I've got this 3-step process here. Breathe well, engage your pelvic floor, and activate that transversus. Now, you can activate your transversus very gently if you're pregnant out there as well. If you're not pregnant, you can engage that transversus a little bit more intensely. The main thing is that you're never bearing down and pushing, and then there is never any pain. There should be no pain in any of the exercises I give you or any exercises that induce any sort of unwell feeling at all. Then something might be happening. So stop doing the exercise if that is the case. So you've got me lying down here, doing some leg slides, doing some adduction and doing some bridging. These are great ways to activate your core, ladies. So breathing well, pelvic floor, lower tummy, and then you can do some leg slides. And I'm happy to send you any of these pictures and or send you the information on these slides. The first one on the left of the screen is the most basic, just doing a leg slide above the floor. The second one in the middle, I'm squeezing around a ball to activate the inside thigh muscles, which will give you a little bit more pelvic floor activation. And the third one there is bridging. Bridging's a great activity. If you don't have time to work your core and floor, then get down and do a few bridges. I should have put a slide where you're actually going up into the bridge, but in this bridge position, we're laying down, and next time I'll add a slide where you're going up into the bridge. Bridging is great for your core. It's great for your glutes. It's great for your quads. It's good for balance. We often say in the older community, if you can bridge, you can always walk and sit to stand. If you can't bridge, if bridging's difficulty, you may have issues as you get older later on in life with walking and sitting to stand. So get bridging, ladies, as much as you can. Okay.
Yeah, one question here. Do we combine these exercises with our breath?
Let's go back. Breathing naturally and rhythmically at all times. And it's a good question, Johanna, because breathing, as we mentioned in the beginning, breathing naturally, but if you're going up with exercise and energy or power, try and exhale. When you exhale, you are likely to get a better pelvic floor lift and a better draw in of the lower abdominal wall. So I would say, listen, if you're starting your bridging, if you're on the floor now, ladies, and you want to try a bridge, literally in your normal natural rhythmic pattern, exhale, lift your bottom off the floor and go up into a bridge. And then you're breathing normally and rhythmically as you go. Okay, have we got a question that popped up there?
I'm 37 weeks pregnant now and needing to pee a lot, also waking up on average 4 times every night to go pee. Is this something to be concerned about, or is this normal at this stage, 37 weeks?
Yeah, it happens frequently. To say that it's normal or not, you've got to be careful, but it does happen frequently, and it can be due to a number of reasons. It can be due to hormones and the changing hormones as your pregnancy, your delivery is coming up, you're 37 weeks. So it could be the increase in progesterone, which is making the organs and tissues in the pelvic floor a little bit softer. It can be the baby's positioning. So sometimes when the baby's head is down and engaged, they're pushing on your bladder. So we hope that the babies are sort of engaging by about week 36, 37. They can move at any stage, but we hope they're head down, and sometimes that push on the bladder can give you that feeling of frequency, having to go to the toilet more often. It can also be a tightened pelvic floor. Remember, your pelvic floor is underneath the uterus. They're holding that uterus muscle up like a sling, and that pelvic floor can get tired. So I'd often recommend laying down in the afternoon, semi-reclined. You don't have to be flat, laying down for 30 to 45 minutes and resting your pelvic floor. Just taking the weight off your pelvic floor, and gravity can really help that a little bit. And otherwise coming in and doing some perineal and pelvic floor releasing. That usually makes a big difference. Usually within a day, I have ladies text me back after we've done that at this stage and say, wow, my frequency's back to normal. I feel great. And they're great right up to the delivery. So it could be for a number of reasons there, but pelvic floor releasing is one of the big ones that does really, really help.
Mm-hmm. Thank you.
Yeah. Did that answer the question? I hope that did. If not, please come back to me. You're welcome. You're welcome. So with those exercises, any questions on any of those 3 exercises, ladies? I'm happy to get down on the floor and show you if there's any doubts. No? Okay. The other exercises as well that I put in here for you are just some gentle ball exercises. We've got some bicep exercises there. So those top exercises from left to right are using a TheraBand. I use a green TheraBand, which is about a 1 kilo resistant for most ladies, but otherwise a 1 kilo free weight from Decathlon. So something like that there, if you can see in my screen, they're just a 1 kilo weight from Decathlon is fine. They're $6 a pair, or a green TheraBand is often easy as well. You can buy those from Decathlon or from any women's health physio as well, and placing that underneath your feet and doing some bicep curls. You've got me on the bottom slide there doing some diagonals. They are for your oblique muscles. Now, both of these exercises are fine to do for most people in pregnancy or post-pregnancy, unless you've got a contraindication or a complication, as you wouldn't do that. But I would often suggest doing those, repeating maybe 10 contractions of each of those, sitting, breathing well, engaging your pelvic floor, engaging that lower transverse muscle just gently if you're pregnant, and doing that with a natural breath. So exhale on the pull up, exhale on the pull up for the bicep and or the diagonal.
Mm-hmm. Danielle, have you got any tips on how to choose the correct size ball for your height?
Yeah, that's a good one. So I'm about 5'3", and I use a size 75 cm ball. And that's standard for most ladies. I would say most ladies between about 5'2" to about 5'6", a size 75 cm. And a good ball, if you look at the side of the ball, it'll have the number on the side. 5 foot and under, I usually use about a 65 cm. And I don't think most people, 55 is quite small. My daughter, who's about 12, would use a 55. So most ladies, I would say, would be a 65 or a 75. Now, that's based on a measurement of height. But otherwise, when you sit on a ball, your knees, if I can position myself like that, these are your knees, and this is your feet. Your knees and hips should be 90 to 110 degrees when you're sitting on the ball here, like that. If you're sitting on the ball, so this is my hips, this is my knees, and you want that 90 to 110 degree angle so you're comfortable. So you wouldn't be sitting completely flat, or what we call downhill, where my pelvis is down, the ball would be too small. If the ball was too big, my pelvis would be too high up here. I want you 90 to 110 degrees while sitting on the ball.
Amazing, thank you. And 5'2" is what in real money, like in centimeters?
So 5'2", I think it's about 163 cm. So I would say 160 cm and above, you're looking at a 75 cm ball. Below 160 cm, you're looking at a 65 cm ball, and really probably in that 140 range cm height, you'd be looking at a 55.
Okay, amazing. Thank you.
Yeah, and just a tip on the balls too. Look, we stock our balls from the States, Canada, and UK. I don't use local manufactured ball or out of the Philippines or China. And the only reason I say that is I get quite a few clients that will bounce on a very cheap ball, and the ball can often rupture, and then the ball breaks, and they end up fracturing their coccyx or hurting their tailbone. Not to say balls from other countries aren't great, but please check the quality of your ball, that it's a nice, thick, durable rubber, that it's got a guarantee with it. The Reebok is usually very, very good, or one of the American brands is very, very good. Just you want a nice, stable, strong ball, nothing that's cheap, that looks flimsy or looks like a sort of semi-deflated balloon.
Yeah, actually, Reebok have a really good one with a weighted bottom so they don't roll away.
Oh, fantastic. That's new to me. That's great to know. I'll have a look at that.
$60 on Amazon, so they're really quite affordable as well.
Oh, that's great. I'll get one of those and have a look at it too. So that would be great, particularly when you're in the labour wards, and afterwards when you're breastfeeding, sitting on a ball, if you want to bounce with a baby, rock the baby, that flat base would be really, really good, actually.
Mm-hmm.
Yeah. So just want to finish off these exercises here with these pumps here. Once again, you take the TheraBand or even a weight if you wanted to across your hands like that. That's it. And you pull out and in and pull out and in. That's terrific. Pull out and in. And you can then draw your tummy inwards a little bit. Now, this one when you're pregnant, if you're trying this exercise, just draw your tummy in gently. And as you draw your tummy in, you exhale the air. So just to show you there, you'd be and in. So the effort is to pull out on the band. And as I pull out on the band, I exhale and draw my tummy in. So a little tummy draw in is all you need. Obviously, postpartum, after you've had your baby, we can activate that tummy a little bit more. Okay. All right, just before we go quickly, and we'll finish up in the last few minutes on breasts and other pelvic issues, are there any questions on any of those exercises? Because I'm happy to get down on the floor if you want me to demonstrate any of those exercises for you, and or send you those exercises, or teach you personally if you like.
I would really love, Danielle, to share it in the group. If you don't mind sending me a PDF or something, that would be helpful for moms who are not able to join the call.
Sure, will do. I'll send that through to you later on, no problems. And ladies, if you have any questions and you're doing those exercises, just get in touch with us and I'll answer those questions individually for you.
Amazing.
Okay. All right. So I'm just going to move on before wrapping up, just on breasts. I see a lot of ladies with breast issues, blocked breast ducts. And I want you to take notice here. If you have any painful breasts, if you have a firmness in your breast prior to feeding that's not normal or natural for you, or it's in a patchy sort of distribution in your breast, or after you've fed and you've thought, gosh, my breast doesn't feel like it's emptied well, it might be that you've got blocked breast ducts, and you want to catch those blocked breast ducts early before they become inflamed or irritated and perhaps develop into mastitis. So fill your breast regularly before you feed and after. They should be sort of emptying very well with no obvious sort of tightened areas or inflamed areas or blocked areas. And if you do, then please come in for real-time, sorry, not real-time ultrasound, come in for ultrasound. There are two types of ultrasound, and that's a good point to highlight. Real-time ultrasound shows imagery and allows us to use it as an educational tool to look at muscles and tissues, whereas therapeutic ultrasound uses sound waves to relax muscles and relax tissues and reduce swelling and inflammation. Both are pain-free. They don't hurt. In fact, they're relieving. So we would use therapeutic ultrasound on the breast. And we commonly talk about that overseas. And I'm finding I'm having to really educate our local community, particularly our doctors, about encouraging the use of ultrasound, just because they haven't heard of how effective it is. So please come in if you've got blocked breast ducts in any way. So the treatments will be ultrasound. The benefits of treatment and or using ice, you get pain-free latching, you get increased milk flow, you reduce the risk of mastitis, and that's inflammation or infection in the breast tissue. And if there's any issues, I can then refer you on to a good lactation consultant as well, and give you support in some good breastfeeding positions and draining the breast better and feeling more comfortable. And if your baby's feeding well, then they're usually sleeping well, and then you're a lot happier as a mummy as well.
Mm-hmm. I love that you mentioned this, because the mastitis protocols have just changed. Actually, the guidelines are very, very different from what they were even 3 years ago. So
Yes.
it's important to know that we no longer encourage warmth. We no longer encourage massage of the breast. So that's where the ultrasound comes in really, really handy to relax those muscles.
Yeah, the protocol has changed, and the ultrasound comes in really, really great. And you'll see there, that's an ice pack that I'm holding there. So we actually sell breast ice packs in here, because ice has now become the go-to for any swelling in the breast, any blocked duct in the breast, whereas years ago it used to be heat and massage. So now we would go to ultrasound and the ice application and good latching and feeding and education, as opposed to those two modalities now.
Mm-hmm.
Okay, so what to look out for just before we finish up on mastitis, because often mums say, well, how do I know if I've got mastitis? How do I know if I've got my blocked ducts? Often you'll see red patches on your breast, and they can be painful, those red patches. There might be heat coming from those red patches as well, and you might find that your milk flow has slowed down somewhat from that breast or from that duct area, or you might even be feeling unwell. So if you suddenly sort of in the middle of the night, or I usually find in the morning, wake up thinking, oh gosh, I just don't feel good here, it feels like I've caught a flu, do check your breasts if there's any signs of redness, any heat coming from that area, if there's patching of the area, one breast looks different to the other, or looks different from the night before, or you do a feed and you find it's not emptying well, it could be the first signs of mastitis. And if it is, you do need to get antibiotics for that. And then after you've had antibiotics within the first 24 hours, some antibiotics we can after 3 hours, ultrasound the breast to reduce that for you. So getting rid of that blocked breast duct as soon as we can and clearing your breast for a good milk flow is what we want to do. Okay, so look out for those excuse me, signs and symptoms. Okay, I just want to mention before we go, pelvic girdle pain. A lot of ladies complain about pelvic girdle pain. So here is the pelvis here. So if you're getting, I hope these pictures are clear, if you're getting any pubis pain in the front here, and or if you're getting any sacral pain at the back here along those sacral joints, that is sacroiliac pain in that distribution here, and that is that pelvic pain in the front. Very, very commonly occurs in pregnancy due to the hormonal changes, the baby's positioning, our fitness levels, and other factors. You might be sitting a lot at work and things like that. You might need one of these belts called a Sorolla belt, and I fit these quite regularly for ladies, and you can wear that after you've had your baby. Often you might need it for about 6 to 12 weeks after you've had your baby as well. So look out for that if you're getting that feeling there. I've just mentioned in the slide, why do we get that? Why do we get this pain in the front or in the back or both? It might be due to sitting at work, postural changes. It might be postural just from pregnancy or from a previous injury that you've had. As I mentioned, hormonal changes, weight gain, baby's position, birthing position. You may have taken a fall or a trip, I really hope not, or anything like that to cause that. So if you're getting any of that pubic pain or sacroiliac pain, ladies, there's a combination of things that we can do, one being the belt. Sometimes ladies often try and buy an equivalent of these belts online. They often get the wrong size and they get the wrong fit or the wrong position. So I'd rather you came in and we fitted with a good American branded belt. Being an Australian, our Aussie ones aren't as good actually as this American one. So I recommend an SIJ belt for you.
Amazing. Any other recommendations, like icing it, or how to get in and out of a cab and avoiding, asymmetry?
Yeah, absolutely. So if you're getting that pubis pain in the front or you're getting that sacral pain, there's a whole lot of education that I can give you, how to get in and out of the car, how to sleep better at home, how to do sports and activities. You can stay active, as particularly if you're wearing this belt. You've just got to stay within a range. So we don't want you taking really big steps forwards or sideways. Staying within your shoulder width range is lovely. Try not to cross one leg over the other, whether it be in V sitting or sitting just at work with one leg crossed over the other. If you're sleeping in bed, putting a pillow between your knees, hugging a pillow can really help. And there's a bit of a tip and a trick to that as well. Even getting in and out of a car, I often say to ladies, look, pretend you've got a really tight skirt on. You've got to keep your legs nicely closed together, and you twist out of the car and get up, as opposed to taking one leg apart and the other leg joining you. So there's lots of tips and tricks. Once you know the little tips and tricks and you put a belt on, you might want to use heat on your lower back. You never put heat on your bellies, ladies, when you're pregnant. That can also help as well. So if you're getting any of that pelvic girdle pain, have a look on our website. There's a whole lot of information, or I'm happy to supply you that information, or come on in and I'll talk to you further about that.
Because it's one thing to go to the physio, but then if we don't change our daily habits and are not mindful of our posture and what we do and how we move, it's often things will come back and they can get aggravated. So
absolutely. And if you can nip it in the bud sooner and quicker, all the better. Get it early. Don't leave and think, oh, it's been 1 or 2 weeks, it's going to go away. Generally in pregnancy, if you can catch it within that 24 to 48 hours, you can settle it down nicely. So come in sooner rather than later. And it can be something, it might be a past injury that's flared up as well. So you've got to really look out for that and come in sooner than later.
Great. Amazing.
Yeah. So are there any questions that's popped up before we do finish up? I'm just mindful of the time and your time, but I'm happy to answer anything.
There's one question here. So one mom is having pelvic girdle pain since she was week 33. She's now 37. She saw a physio and she's doing the little things you mentioned, which helped. It's not too bad. So I'm not using the belt. Should I still consider it now before birth?
Yes, yeah, I would still consider using the belt before birth. It'll just give your muscles, when you keep your pelvis in a good position and locked in a good position with the belt. I hope you can see in that picture.
Sorry, Danielle, stop sharing, and then we have a bigger picture of your pelvis.
Okay. Stop sharing there. Fantastic. Aha. Can you see me now? Can they see me now? Yeah. Yeah, you can. Oh, great. Okay, I can't see my picture of me here, so I'll focus. How do we bring it up here? I am computer challenged or IT challenged, ladies, of those that know me well. So I'm very lucky I've got my lovely receptionist, Jolene. Fantastic helping us here. So here we are with the pelvis here. So once you place that belt, and this is the one of the belts, this is just an example of one of them. There. And I'm going to angle you down there. There we go. So once I place that belt in that right position there, that force closes my pelvis together. It brings my pelvis close together, and then I can tighten that belt up by taking it, I've got it upside down, but taking it like that. And taking it like that. So I can tighten the sides up. So now I've got that pelvis secured through here. So that's what we're trying to do. We're trying to place that belt around there and secure that pelvis there together. And to answer your question, is it still worth doing at 32 weeks pregnant? Yes. Because when your pelvis is in a good position, your muscles work more functionally and more effectively. You'll get less fatigued, you'll be able to do more things, and hopefully you won't be in any pain. I'd like you to have a pain-free pregnancy. So if it means putting on a belt, doing your exercises, applying a little bit of heat with a little bit of education, and you're pain-free and active, you're likely to have a far more successful and pain-free birth.
Yeah. The other thing that I find is that people tend to, if they have pain and instability as well, they tend to really grip their muscles, and that affects their birth in a great way because they can't let go. With every contraction, where your uterus does this hard work and contracts to bring your baby down, often it's counterintuitive to learn that relaxation that we need on the bottom. So I think that seeing a physio as well can be super, super helpful.
Yeah, absolutely, definitely. The breathing, being relaxed, firsthand, Johanna, how much that really contributes to an easier birth. Absolutely. And with pain, we're always tight and we're always stressed with any form of pain. So if we can knock out that pain and reduce that prior to giving birth, well, absolutely.
Yeah, I really love that. I had one question that came in anonymously, which was a mom is in the postpartum period. She can't get to 10 repetitions. So she's just given birth to her baby. What is normal? Like sorry, 10, you said 30 repetitions actually for the pelvic floor, right?
Yep.
What am I to expect if I've just given birth? If I can't do those 30, do I gradually increase? Where should I be starting? I mean, how long's a piece of string, I guess, but.
Yeah, look, thank you for asking that question because it's a really good question. The literature supports 30 repetitions to build up any muscle mass, but the reality is that most of us, postpartum or otherwise, will struggle to get 30 repetitions. So I often say to mums at any stage, whether it's pregnant or post-delivery or in the menopausal phase, and you're learning pelvic floor and you're getting a pelvic floor stronger, start with little and often. So I would say, listen, aim for that 5 to 10 second hold. Just build up with your 10-second hold and build up with your repetitions. So if you come in and we have a look at how effective your hold is, let's say you hold well for 5 seconds. Then I'd say, listen, hold well for 5 seconds, relax for 5 to 10 seconds, and let's just aim for 3 at a time. After about a week, maybe you'll get to 5 at a time. After about 2 weeks, you're going to get to 8 at a time. So build up slowly. Remember, after you've given birth, you're challenged by hormones and relaxin and elasticity. You're challenged by fatigue and you're challenged by trying to find a routine. And these muscles are working probably harder than they've done because you're up regularly feeding a baby every couple of hours. Some nights you won't get rest at all. So the muscles are fatigued and they're not going to respond as well. So we give you that to say, listen, aim for 10 repetitions of the fast, aim for 10 repetitions of the slow, and maybe 3 sets throughout the day will get you 30. But the reality is do them little and often and comfortably. I often say to mums, hey, every time you have a glass of water, do 5 quick, do 2 slow. Every time that you go to eat something for lunch or you go to eat a meal, do a couple before the meal. Every time you brush your teeth or every time you're in the shower, something that you do regularly every day to prompt you, oh, I haven't done my pelvic floor. One of the best times to do your pelvic floor is when you're feeding your baby, whether you're bottle feeding or latching. Do your pelvic floor at that stage. Sometimes due to the hormones of relaxin, your pelvic floor won't contract and be as functional at that time, but you're still doing a pelvic floor contraction. You're still giving it a go. So do them when you're feeding and when you're not feeding. There's all different effects on the pelvic floor, so little and often. There's a couple of gynaes out there that'll tell you to do 300 of the pelvic floor at a time, and I love the fact that they say that. And why do they say that? Because we know patient compliance is we're going to be lucky for people to get 10 to 30 in a day. So they'll say, look, do 300 a day. It's impossible to get that 300, but try and work towards that 30 if you can, little and often.
I have actually had clients who do the 300 and they have an incredibly tight pelvic floor. And as we know, a tight pelvic floor is not functional. There's a difference between strong and responsive and tight, right? So
that's right. You don't. Yeah, you don't want that pelvic floor to go into high tone or hypertonicity because you've overactivated it as well. So with the best intentions, I've spoken to a couple of the doctors that do say that, and they say, oh, we just say that because we just want them to do more and more if they can. So please, 30 is what we're aiming for, little and often, and build up slowly. Be kind to yourself. You know, it's a pregnancy and postpartum is a marathon. It's not a sprint. And the pelvic floor, although it will help you in sprinting, is not a sprint muscle at the best of times. So you need those quick contractions and you need those slow contractions, little and often as you can.
Amazing. Thank you, Danielle. Mummies, we have a couple more minutes for you to ask questions if you'd like. What else did I write?
Do you need me to get down and do any of those exercises? Or does anyone need me to show you those exercises? I will send the diagrams through to you, though, Johanna. But
I think sharing the PDF will be helpful for people to be able to have a look.
Okay.
Any idea of, any thoughts on stretch marks and why they happen? Why do some people have them more than others? And even the herniation of the belly button and so on? What are your thoughts?
Well, at the moment, I'm actually doing a paper on DRAM and having a look at that. And there's a number of reasons why that herniation and those stretch marks and things occur. One of them is, one of the main things is genetics. We are all, there are several types of different collagen that we have in our skin, believe it or not. I've come up with about 11 so far. And that depends on your genetic inheritance as to how your skin stretches. I guess that's why some people age more gracefully than other people age. So some of us are going to be prone to stretch marks, whether we like them or not. In terms of the herniation, the same. A lot of it is to do with our pre-fitness levels and our tummy muscles and how strong they were prior to being pregnant. Add that genetic factor involved as well, add the position of the baby as well, sometimes transversely or sitting in one area. And larger babies, we consider a larger baby 4 kilos or more in the West, but honestly in Asia, I honestly think sort of 3.2 and above is quite a large baby for some people to have. So that abdominal wall gets more and more stretched as well. So there are a number of reasons why hernias occur, genetic, positional, fitness, hormonal as well. Males and females get hernias as well. Males and females get stretch marks as well. So we can't blame all our stretch marks on pregnancy. Some of it is the elastin and the collagen.
Yeah, absolutely. I have had some clients as well, when you're talking about the core, I was thinking that, who said, I shouldn't be doing core exercises, or, my core is not important in pregnancy, I should train it after. But the reality is that that you're using your core when you're pushing as well. And mastering your core can be really, really make your, can really make your pushing more effective. So working with a physio on that is also, a good investment, I find. So.
Yeah, absolutely. You should be working on your core and floor muscles for your entire life, whether you're pregnant or otherwise, through youth, through adolescence, through menopause and aging. It's our core. If you think of your core, the diaphragm being the top, the pelvic floor being the bottom, and those muscles I mentioned in between, I like to think of this as like a tree trunk, and the branches of the tree, and our legs are the rooting system of the tree. Now, if your trunk is not strong and stable, like a good solid oak tree, first push or shove or movement that's not normal for you, you're going to have some problems. So if you think about a tree that we plant in the ground, we put a nice stake, we put a nice branch, a sort of a metal piece behind it, or we put a stake or a wood behind it to give it some support. Your core is your trunk. If you don't work on that core through all your stages, you're going to end up with problems either above it, below it, or out to the side. It's our core that allows us to sit, to stand, to walk. It's our core that allows us to be pain-free on activity and movement. So we've just got to keep our core going through the different stages of life with the different forms of exercise. Obviously, as you get older, you're not going to be doing maybe the marathons that you were doing before, but you can still do a variation of core activity. So I guess to answer that question, there is exercises appropriate for all levels of core activity for all stages of our lifing process. And don't ever stop working on your core, whether you're pregnant or otherwise.
Absolutely. Amazing. Thank you so much, Danielle. This was a very informative talk. I really liked it. And you actually managed to show us all the slides. Well done, you.
I know. I apologize if I was moving quickly, particularly in the beginning. I was so worried about not getting through things for you guys. And I hope you get the recording. And if you need any further explanation, please don't hesitate to ask or come in. It's been my pleasure to talk to you today.
Amazing. We'll be sharing the link, and thank you so much for all the moms who showed up. And I look forward to seeing you next Wednesday at 10 o'clock for our next coffee morning. Okay, everybody have a good week.
Thank you, ladies. I appreciate you. Have a great day. Thank you very much, Johanna and Diana. I appreciate you guys. Take care.
Bye.